What's your dental brand? If you think it's just your name, logo, and colors, you're only scratching the surface. I'll tell you how to take your brand to another level when we return. Colin here, and I hate the term branding. Too often I've seen companies waste dentist money on branding, which generally means designing a logo and a slogan, coming up with a color scheme, and then putting them on every paper and digital document they can find. Sometimes this will even extend to the doctor's office colors and even the color the staff wears around the office. It seems like a lot of overkill with very little ROI, but every dentist should still have a brand, because a brand is ultimately what sets you apart from other dentists in your area. Now, the most obvious elements of a brand are name, logo, colors, etc., but it's so much more than that. It's what the practice believes in and how it's different from every other truly gentle dentist who treats his patient like family, from every cosmetic dentist in town, from the best dentist in town, and what you do that would make a patient choose you over anybody else. Here's how you really go about finding your brand. First, you got to figure out what makes you different. Why does somebody want to come see you instead of the guy down the road? What can you relay to a prospect in their language that tells them to choose you over the guy next door? Then, decide how you and your staff are going to represent and sell your brand. What's your elevator speech associated with, what you tell everybody that walks into your practice? Why are you a dentist, and how does that affect what makes you different? Why is how you are different better for the patients? It needs to touch on people's emotions and reason. And if you can't articulate it, you're not clear enough on it. Go back to step 1. Step 3, once you can articulate your brand, work on how you represent your brand. This is where the logo, fonts, colors, taglines, design, all that starts to come into play. And these are visual representations of your brand, not the other way around. This is what ties your various marketing pieces together and what people think of as your brand identity. Consistency is important, but not set in stone. When you design your brand identity, you want to use it without deviation wherever possible. But don't plan for every contingency, and sometimes something comes along that requires you to go outside of your brand identity. Sometimes it's just a minor tweak, and sometimes it's a major addition or change. And the same is true for the brand itself. Over time, your position in the marketplace, your goals, your staff, and your beliefs are going to change. The brand needs to be flexible enough to change as well. That's why you need to remember that a brand is a living thing. It may stay the same as its core, it may grow and change, then again, it may change entirely. But willing to accept that change happens, and just be open to it. It's better to adjust your brand to the realities of the dental practice marketplace that you're in than to misrepresent who you are or be targeting the wrong kinds of people. Good luck in developing it so you can attract more and better patients, more of the patients that you want. We're going to finish up the week tomorrow by looking at ways to create content that people not only read, but share and keep. Until then, keep moving forward.